Hi everyone, and welcome to our video series about nocturnal blood pressure presented to you by Digi Health Services. In this video, we will talk about abnormal conditions and patterns of blood pressure during sleep. Understanding abnormal nocturnal blood pressure patterns is crucial for diagnosing underlying health conditions and assessing cardiovascular risk. While normal variations in blood pressure during sleep involve a predictable dip, deviations from this pattern can indicate significant clinical concerns. So, what are those abnormal patterns? The main types of abnormal patterns observed during sleep are: first, we have the non-dippers pattern, in which there is less than a 10% decrease in blood pressure during the night. This pattern is associated with an increased cardiovascular risk and is often seen in individuals with resistant hypertension or those who have poor blood pressure control. Then we see the reverse dippers pattern, which is characterized by an increase in blood pressure during sleep. This pattern is highly concerning and linked with the highest cardiovascular risk, including a greater likelihood of stroke and heart attack. It is often observed in patients with advanced kidney disease, severe sleep apnea, or significant atherosclerosis. And finally, there is the extreme dipper pattern. Although a decrease of more than 20% might seem beneficial, extreme dipping can lead to ischemic episodes in the brain or heart, particularly in elderly patients or those with existing vascular problems. Why do we have all those abnormal patterns? To explain that, we realize that the autonomic nervous system, which controls blood pressure, plays a significant role in the development of abnormal nocturnal blood pressure patterns. In normal conditions, the sympathetic nervous system's activity decreases during sleep, leading to dilation of blood vessels and a consequent drop in blood pressure. However, disruptions in autonomic function can lead to insufficient nocturnal blood pressure decline or even nocturnal hypertension. The factors contributing to these disruptions include: first, the endocrine disorders. This includes conditions like pheochromocytoma and Cushing's syndrome, which can alter hormone levels that regulate blood pressure. Then we have obstructive sleep apnea, or OSA, which causes intermittent nocturnal hypoxia and hypercapnia, which leads to increased sympathetic nervous system activity and blood pressure. In addition, renal diseases such as impaired kidney function that affect sodium and water balance adversely impact blood pressure control. Research has consistently shown that abnormal nocturnal blood pressure patterns are linked with worse health outcomes. For example, non-dippers have a significantly higher risk of developing cardiovascular diseases compared to normal dippers. Also, a study published in the Journal of Hypertension highlighted that the reverse dipper pattern had a markedly higher rate of cardiovascular events. Additionally, the extreme dipper pattern, while less common, has been associated with acute ischemic events during sleep, suggesting that overly significant drops in blood pressure can compromise blood flow to critical organs. Identifying abnormal patterns requires accurate and continuous blood pressure monitoring, typically achieved through ambulatory blood pressure monitoring, or ABPM. ABPM allows blood pressure assessment at regular intervals throughout the night and is essential for diagnosing different nocturnal patterns. The implications of abnormal nocturnal blood pressure patterns are significant, influencing the management strategies for patients with hypertension and associated comorbidities. Understanding these patterns helps pinpoint potential underlying disorders and guides the customization of treatment approaches to optimize cardiovascular health and reduce the risk of adverse outcomes. Thank you for your attendance. Please share your feedback, comments, and questions. We look forward to your attendance with our next videos of this series.